Now we're going to see Clostridium botulinum. Clostridium botulinum, again, a kind of Clostridium, is a gram-positive rod, anaerobic rod, that produces botulinum. Botulinum could be primarily in the adult people, in the adult person, or in the child. If it is adult form, usually is because ingestion of the toxin preformed. So his ingestion of toxin preformed, and in the child usually is because ingestion of the spore and then germination in the GI tract. The source is honey, and the source here are alkaline vegetables, canned food. It usually is when the canned food is inflated, that is the canned that we cannot eat, because that is the one that has the Clostridium, because Clostridium, it is anaerobic and so produces carbon dioxide, and so the canned is inflated, and it can look that it is a better one because it has more food, but no, it is bad because it contains the Clostridium perfringens with the toxins that already are done. So these preformed toxins are the ones that the patient is going to ingest, and so all the symptomatology of the botulinum. Now to the symptomatology, this is the toxin is going to go from the blood to the neuromuscular junction, and in the neuromuscular junction binds here to the vesicles. Well, no, not exactly the vesicles. Here is the muscle, here is the synaptic button. When the synaptic button, the membrane of the synaptic button is going to fill with the membrane of the vesicle containing acetylcholine. This is inhibited by the Clostridium botulinum toxin because binds to here to the membrane of the synaptic button that aid in the to the molecules of the that are in the membrane that inhibits the diffusion. So when the toxin of botulinum of Clostridium botulinum binds to the CNAP proteins that are in the membrane of the synaptic button, these proteins aid in the fusion of the vesicle and the membrane of the synaptic button, but because the toxin is binding to this protein, so we cannot fuse, and so we cannot release the acetylcholine, and so the muscle do not contract. So the symptomatology is flaccid paralysis of all the eyes, all the extremities, could have dysphagia, could compromise the respiratory airway. So usually it's just dysarthria and the ptosis of the lid, dysarthria, and there are these of botulinum, Clostridium botulinum produces floppy baby syndrome. This is in the child or in the neonate, produces the same symptomatology, but flaccid paralysis because the baby is going to look all flat, and the crying is going to be very weak. So the recommendation is don't to give honey to kids that are less than 2 years, but usually never. Like we are now almost 20 years old, and we continue not eating honey, nor any kind of honey, especially bee honey. Don't. Next, the treatment is with antitoxin. Antitoxin first was made with equine antitoxin. Now we have some human antitoxin against 3 kinds of Clostridium botulinum. There are like 7. For child, yes, we should give this made in the human. For wound infection, that is, the spore is introduced into the wound infection and produces the same symptomatology as food-borne infection. here we would have give equine antitoxin. And the prevention is also done to eat the canned food, or at least heated it and not taking the infected canned. Also, the paralysis begins from proximal to distal. It looks like descending fashion, and if we do high rate firing of the nerve, this helps the patient because we are firing a lot, and so at the end we have a lot of calcium here that ultimately can produce the fusion when enters, produce the fusion of the vesicle. So for that it helps. But with continuing the stimulation of the nerve, the action potential of the muscle is decreased because we cannot pass the acetylcholine from the nerve to the muscle. Kind of myasthenia gravis. It looks similar in that sense, in the sense that with stimulation decreases. Also, the detection for the toxin in the neonates could be from stool. We would look for the toxin in the stool, and in the adult form, we would look for it in the suspected